Okay, so today I'm going to talk about the three main solutions if you are getting all of your teeth replaced. So it would be a full prosthetic. Partial prosthetics have a whole lot more going on to them, and that would be an entirely separate video. So this is just a full solutions. So before I start, I just want to say I am studying medicine. I have studied this subject specifically quite a lot. However, I am not licensed. I don't practice medicine. This isn't necessarily medical advice. It's just, what I've found, and I'm sharing that with you guys. So there are three main solutions, and the number one and most obvious one would be a set of full conventional dentures. So this would be a likely acrylic mold, that's fully removable. It just suction cups to your gums. There's nothing implanted into the gums or anything. Basically, the procedure, the preparation for the procedure is very straightforward. It would just be, full extractions, and they can place an immediate denture. It may not be your final immediately after surgery, so they would obviously take impressions beforehand or a 3D scan. And when you get into the more complicated solutions, I would recommend you go to a dentist that has a 3D scanner. But with full regular dentures, impressions do just fine. So right after that procedure, they would place an immediate denture, and you're going to expect, decent pain. It just depends on how many extractions you get, how sensitive you are to that pain. You may have had extractions before, so kind of judge it from that, because everyone's completely different. So there's no telling, how bad or good it's going to be. Are you going to look like a chipmunk, or are you going to be like me, where I just kind of don't really get anything, and it's 48 hours of pain. You'll get prescribed medications. If you have very, very, very bad teeth, you may get a round of antibiotics. It's extremely important to take all of those. Don't just stop midway through the regimen when you're feeling better. Don't just not take them because you aren't feeling bad. There's a lot of stuff going on that you're not seeing, a lot of stuff internally, so take that entire course. They may prescribe like a hydrocodone or some type of opiate medication. The recovery for full dentures is going to be, multiple months. It can be 3 to 6 depending on who you are. Again, everybody's different, but everybody's gums are going to be constantly shifting after the removal of your teeth, because stuff is no longer there. Your body's going to readjust to that. So generally, people will go in every 1 to 2 weeks, and their dentist will slightly readjust their dentures and the suction cup force. So they'll slightly readjust that surface. So basically, if you do that, you shouldn't have to use any type of adhesive or anything. If you have a good dentist who does a good set of dentures, and you get them adjusted often during the healing phase, you shouldn't need adhesive. So the benefits of conventional dentures are, it's going to be the cheapest option. It's going to be the fastest, most likely. It's going to be the most widely available. It's going to help get rid of any tooth infections that you may have, because obviously it won't be a part of your mouth anymore. They're very large and clunky in your mouth. They're going to cover the palate, the roof of your mouth. So that's going to affect your taste, actually. So it's not all just about the taste buds of the tongue. So the whole roof of your mouth is covered, so it will affect your taste. They can rock back and forth. Even the best fitting dentures, when you're chewing stuff, especially the lower denture, can kind of rock back and forth like that. So my recommendation with full dentures is, if you don't have a lot of money but you have a lot of teeth that are giving you a lot of trouble, and you may need to get this procedure done, and you can't afford the other options, at least get this done so you get those infected teeth out of your mouth, and then at a later time, if you have more money, get that done. Dealing with the large clunkiness of it is more worth a tooth infection potentially spreading and causing a whole host of issues, and I won't even get into that, but basically almost anything can happen if an infection spreads. So avoid that. Just get it done. You may get that energy boost, and you'll just feel a lot better. Other than, obviously, it's going to be a change. You're going to have to get used to it. So the second solution that is most commonly offered is called a snap-in denture, or they can be called implant retained dentures, or they can be called overdentures. It's all the same thing. So this is a reduced clunkiness version of what I was just talking about, and it also has receivers that will snap into several implants in your mouth, 4 to 6 on the top and 2 to 6 on the bottom. Preparations for this is going to start out a lot like dentures. This is what I was talking about, where when you go to get impressions or a 3D scan, I would really recommend finding a dentist that has a 3D scanner. It tells you that they have the latest and greatest technology. It's much more accurate, and it's been out for a while. So, dentists that are doing conventional impressions at this point are kind of trying to save on money, and this is a delicate situation with your mouth, where of course it's extremely expensive. You want to save as much money as you can, but you cannot cheap out on this. You can have severe complications. So you totally can do this with regular impressions and be just fine. But personally, I think that finding a dentist, if you can, who does 3D scans for this is much better. So you're going to get your 3D scans, and then you're going to get scheduled for surgery. So at that point, that's between you and your dentist. What happens, I'll just go over kind of like in general what maybe the average Joe has. So he gets all of his teeth extracted, in one appointment, which is common. They'll do that. And at that point, they will also have assessed the bone, especially in your maxilla, so upper mouth, because it's a lot thinner and softer. If you need, they will do bone grafting at that time. So when they extract the tooth, they're going to put in a medium in that hole that will stimulate your own bone to grow. So it's not like you'd think of a skin graft for burns, where they take it from here and put it here. It's a synthetic or organic material that stimulates your own bone to grow, and that is really important because you're going to want a solid foundation for those implants to go in, and those implants, you want them to last a lifetime. So if you're young like me, that could be multiple decades. So you don't want them to be loose or anything, and you're getting this procedure primarily for the stability. So if you're getting this procedure for the stability, but you don't have implants that are stable, it doesn't really make a whole lot of sense. After that bone grafting procedure, some people will continue on without any teeth or prosthetic, which I haven't seen too often. Usually what the dentist will do is put you in, the conventional set of dentures, just like we talked about in solution number 1. And they'll be big and clunky, and you'll have to deal with them, but at least you won't have no teeth. You'll be able to go out in public and, feel okay. I know I wouldn't want to go out in public if I didn't have any teeth. So They'll do the same sort of process with your immediates and adjust them every couple of weeks just so they're as stable as they can be, and you can chew. Your healing process at that point is going to be a lot longer than just a conventional tooth extraction. So with implants, they can be 3 to 6 months, but usually 3 to 4 months until the dentist feels comfortable actually snapping on the prosthetic to them and loading them. After about 3 to 4 months, they will either have your final dentures made as a separate unit, or they will adjust your current immediate dentures to have the little receivers to be able to snap in. It just depends on your dentist and what they want to do. So just kind of a general overview here. So the benefits of the snap-in dentures are they're going to be less bulky. They're still going to be more bulky than regular teeth, but they're definitely going to be way less bulky than conventional dentures. And you can usually get it to where the dentist doesn't have to add prosthetic to the roof of the mouth, and that improves a lot, like I was saying before, with taste, but also with speech and just overall comfort. And they're not going to rock back and forth as much. Depending on what kind you get, you can get acrylic, or you can get other kinds like porcelain or zirconia. So you can get stronger materials with this option. The drawbacks of this solution is it's multiple times more expensive than regular dentures. And I'll make a separate video about cost because that's a whole nother video, but most of it comes from the implants. It's just an expensive procedure. So you're going to expect to pay a lot more. Usually, people are taking out loans for this. You're going to have a longer healing time with implants. Like we talked about, it'll be 3-4 months longer because now your gums have to heal and the implants have to get settled in, and the bone has to integrate with them. And lastly, you're going to have multiple procedures. Sometimes they will do the extractions and the grafts, and then in 3 months you will do the implants, and then in 3 months from there you'll get the finals. If you do the top and then the bottom, you could be looking at 2 years in the whole process. So it depends on what you decide and what is available for you personally. But it's definitely quite longer. It's the longest option actually for the overall procedure. This is the option that I'm going with. I would recommend this if you have your finances in order, but you can't pay $1 billion for a set of really good ones, which we'll talk about next, and you don't want the crappiness of the big bulky dentures and having to deal with all that. My second recommendation with that, I said a little bit earlier, kind of shop dentists. So if one only offers impressions, get a different opinion. Also, you're going to be dealing with somewhere in the range of the price of a car with this buy, and cars have a big range, and that's kind of what we're talking about here. It just depends on the person, but it will be expensive. So it's always good to shop around, but like I had said, don't cheap out too much on these. Lastly, you're going to want to ask your dentist to place your implants in a way that if you were to upgrade to an all-on-4 set, which is our last option, you'll be able to do that. Because if your dentist doesn't know about that, they're going to place the implants wherever they can to get the best strength, and that may not work out with an all-on-4 denture. Lastly, we'll talk about the all-on-4 denture. This is the top of the line, the Cadillac, the best option that you can possibly go for. This has a whole lot of benefits. This is going to be almost indistinguishable from your regular teeth. It's a very, very thin and small prosthetic little arch that will be screwed into implants, so you can't take them out on command like you can with the snap-in dentures or the regulars. Your dentist would be able to do that. For the most part, they're permanent, and you will get them serviced every so often, and your dentist will be able to take them off and do all of that. Prep might be similar to snap-ins, where you're going to have bone grafting done first. With this being the most secure option, they're going to want to make sure that they get them placed correctly, but also get them placed into bone that's extremely strong. So you may, it depends on who you are, but some people have to get significant bone grafting procedures, and that's very expensive. So if you qualify, if you have good enough bone and you don't need any bone grafting or anything like that, they can do teeth in a day sometimes. Just depends on who you are, but you might get lucky. And if you have the money, they'll pull out the teeth, they'll put the implants in, and they'll put the all-on-4 on that same day. So it's one appointment. Procedure is extremely similar to snap-in dentures. They'll do 4 to 6 on the top. They'll do a minimum of 4 on the bottom, and some people will get 6 on the bottom as well. So it just depends. When they place the implants, they will also place the prosthetic that day as well. So you'll leave the office with the full prosthetic. The recovery is going to be about the same as snap-in dentures. You're going to have a couple of months for those implants to heal and really start to feel good when you're actually chewing down on stuff really hard. Same amount of pain as the snap-in dentures would be, because this is essentially the same amount of prep work. This one's going to have a lot of benefits. It's going to mimic your regular teeth. It's not going to feel a whole lot different. It'll be the lightest and least bulky. They are permanent. You can't take them out. Some people get a little freaked out at the fact that they can, take their teeth out. So it's very similar to your real teeth. They look great. They have extremely strong materials that you can get, like a zirconia type material. It's an alloy of zirconium. It's very, very strong. With these, you'll have less adjustment because a lot of that adjustment will be done surgically during the procedure with your bone. The drawbacks of this procedure, number one, obviously, it is incredibly expensive. I will break it down in a further video, but I personally was quoted $75,000 for it. It's not a cheap procedure. We didn't talk about this with the snap-in dentures, but with any implants, implants can fail. They can, get infected. Same sort of thing with any medical procedure. It can fail. There can be complications. With the all-on-4, the focus on the bone strength is a lot greater, so you may need that bigger bone grafting procedure that may add additional cost. It's sort of a web, but it depends. It depends on who you are, and really the biggest drawback of this one is going to be the price. My recommendation with this is, if you do have the money to spend, do this procedure. It's much faster. It's much more permanent. It's extremely expensive, but in my opinion, it is worth it. I believe with the increase in 3D printing technology nowadays, this procedure will come down in price significantly in the next few years, but that's going to take time. It may even be a decade, who knows. And my last recommendation for this, and really any of the procedures, is do not do these procedures for cosmetic reasons. So if you have healthy teeth, if you're capable of keeping all of your teeth, do not get any type of full extraction or full prosthetic procedure. Don't get your teeth ground down and get crowns on there. Take care of your regular teeth and have regular maintenance done. There are other procedures if you want cosmetic stuff. This is for people who are required to have no teeth. That'll wrap it all up for this video. I'd love it if you leave a like on the video or leave a comment below. If you have any new information, feel free to comment as well. Medicine changes daily, so be careful if you're watching this video 5 years in the future If you are, I hope it's less expensive. Be on the lookout for a cost breakdown video, and we'll see you guys later.